I'll start. It is 8 o'clock, so it is the hour to start, ladies and gentlemen. Thank you so much for joining me. I'm honored that you're giving me some of your important time. Usually people choose to do that, though, because they've had issues, and so I'm sorry if that's the case for you, but I do promise to give you really good information that is actionable and helpful, and I hope you'll appreciate that. I'm going to share my screen here, so you can see the slides that I'm going to share with you here. So my lead slide says, the truth about lower back pain and sciatica. My name is Troy Vandermolen. I'm with a company called Kinetic Edge Physical Therapy. We've done a ton of these online workshops since COVID hit. Prior to that, we did a lot of in-person workshops, and those are great because it's easy to interact with people. We see each other, we're in the same room, we can see the whites of each other's eyes. I can't see you, hopefully you can see and hear me well tonight, but I can't see and hear you. But that doesn't mean that we can't interact with each other. If you have any questions at all tonight, just click on that chat icon. You can type a short message in there. Any question you want to have answered, I'll get to that. If I don't get to it while we're talking tonight, I promise I will get back to you on it. Sometimes there's so many, it's hard to get to them all. And we got to honor each other's time as well. So we're going to do that. I will give you my contact information too. At the very least, I want to be a good resource for you, and you'll be able to get a hold of me using my email or the cell phone number that you can contact me just like that. You get that at the end of the night tonight. Why in the world would you want to listen to me though? Well, let me tell you a little bit about myself. I'm a proud graduate of the University of Iowa's physical therapy program. It's actually been over 25 years ago now, which is amazing to think about. The University of Iowa program is really good. It's consistently ranked in the top 2 or 3 in the nation. I am proud to have gone there, but honestly, what you're going to learn tonight are things that people learn by being in the middle of this, helping people for 25 years. You're going to learn what I've learned in the trenches, commonalities that I've seen in so many people with low back pain over the years. You're going to benefit from that tonight because when you see that many people, you start to see patterns and trends. You see what works and you see what doesn't work. And I'm happy to be able to share that with you tonight. My company, Kinetic Edge Physical Therapy, has been around for 25 years or so, getting close to it anyway. We have 7 clinics in Central and South Central Iowa. Low back pain is the most common condition that people suffer who come to see us. So you're going to get some knowledge from that. It's not just me that helps these people at Kinetic Edge Physical Therapy. We have 25 physical therapists, pretty much all of them very equipped to see this in the way that I'm going to talk about tonight. You'll understand the philosophy of care that we take and why it's a little bit different than so many other options of care for low back pain are. Oftentimes we get to this point and people are wondering, am I really supposed to be here? Is this the right workshop for me? So if you're finding, like so many others, that you've got a problem that's progressively worsening, most people who sit here and listen to me do this workshop say, well, when it started, it wasn't that big of a deal, but it's definitely becoming a much more significant issue. And as a result, I'm not doing the things that I want to be able to do, or I'm not doing them as well as I want to do them. And they start to wonder, are they going to have to be more dependent upon others? And most Americans crave independence. And any of these musculoskeletal issues, and especially lower back pain issues, are a threat to that independence. And so if you're concerned about becoming more dependent on others, about losing your independence, this is a great place for you to be tonight. Many of these same people ask really difficult questions like, what in the world do I need to do to make this go away? Some are even saying, do I just need a surgery? Is that going to be the answer for me? If you're asking questions like that, it's a good place for you to be tonight. A lot of people who deal with low back pain do pretty well, but if they move just wrong, it can really set them off. So if you're afraid of doing something, moving just wrong and really making it ticked off, this is a good place for you to be tonight. Most people who are here have tried many things before and have not got the results that they wanted, and they really don't know what to do. This is what this workshop is designed for, to give you true answers, things that get to the root of the problem. Ultimately, when your back hurts and you choose to do less because it's problematic for you, it can be more than a back issue. It becomes a more significant, broader issue for people as well. Pain can negatively impact our overall health. We'll talk a little bit about that tonight. And I think that's important for you to understand, because if you can find the solution to your low back pain, it can unlock overall health. So many of the things that we deal with are cumulative in nature, including musculoskeletal low back pain issues, but so too are other general health issues that plague Americans for sure. You're going to learn a truth tonight. When we talk about what's going on with your back, we can't talk about your back without considering the environment that it's in. Most back issues aren't back problems. The back is experiencing some kind of mechanical stress because something around the back isn't doing its job well, and the back is dealing with issues related to compensations. The reality is we are impacted most by the people closest to us, and we impact those who are closest to us. And when we hurt, it's hard for us to do that. Your low back is the same. It is impacted most by the things around it. We need to figure out what those things are. Otherwise, the problem continues. Now, who is this workshop not for? Maybe you. I wish I could tell you tonight, I've got this really simple, get quick, better, quick fix for you. Snap your fingers and it's going away. I wish I could say that. It's not true. That doesn't exist. There are lots of products, promises out there on the internet of things, simple solutions for low back pain. I can tell you the most likely thing you're going to lose is not your pain, but your dollars with those kind of things. So if you were hoping to find the get better, quick fix solution, I'm not going to share that with you tonight because it doesn't exist. I am going to tell you how you can help your body naturally heal. And I'm going to hopefully get you to a point where you can realize you don't need to have medications, injections, and surgeries. In fact, you're going to learn tonight that those aren't even solutions. Those are ways to mask issues. Those don't get to the root of the issue. If you are more interested in masking your symptoms and not truly getting to the root of it, this is definitely not the workshop for you. This is the workshop for people that want to get to the root of the problem. And though it's not a get quick fix solution, I always say that wrong. It's not a get better, quick fix solution. It is not necessarily complicated to do it. It just takes the consistent application of some key principles to gain mastery over this. And that's what we're going to talk about tonight. Now, I do want some feedback from you right now. I want you to click on that chat button. I want you to tell me, are there specific things that if you do this, you know your back's going to hurt? What activities elicit the pain? What specific things do you try to avoid because you know it's going to be problematic for you? Is there an activity, a posture, or position that you know makes it hurt worse? If you would, please just type that down for me. Type it in that chat box when you click the chat icon. And then you can tell me, how bad is it on the 1 to 10 scale? 10 is emergency room pain, the worst imaginable pain, and 1 is barely noticeable. Okay. And then finally, how long have you been dealing with this? Now, I'm asking these questions for a specific purpose. The first one, what makes you hurt, is really important to understand. In fact, you're going to hear me say this in a little bit, but if you can say, yes, there is something that makes me hurt, that's not necessarily bad news. There's a ray of hope that comes with that. If you can answer, yes, there is something, and this is it, that it gives me optimism that what we're going to talk about tonight is going to be helpful for you. You'll learn about that in a brief moment. The other questions about how bad the pain is and how long you've experienced it, that doesn't tell me if what I'm going to tell you about tonight can be beneficial for you, but it might give us an indication whether it's going to take you, a few weeks or several weeks to make it get better. The longer it's been around, the higher the pain gets. It takes a little bit more time to get to the point where you settle the score with this thing. But if there are specific things that you know make your back pain worse, that's not necessarily bad news, because we like to say that if your pain is reproducible, then it's also reducible. If there's something that reproduces it, we can do something else to reduce it. Now, I've listed 10 things here, the 10 things I hear most often people complain are problematic with back pain. You can see there's lots of weight-bearing activities. You're upright, walking, standing, and sitting. The combination of bending and twisting is pretty difficult for a lot of people. Putting on your shoes, that requires you to bend over. So that's a functional application of forward bending. And let's see, Rochelle says standing more than 20 to 30 minutes causes aching, pins and needles down the leg. I'm glad you said that, Rochelle. Thank you for saying that. There's a difference between people that have back pain that is worse when they're upright standing, and people that have back pain that's worse when they're sitting. We're going to talk a little bit about that tonight. The fact that you get symptoms that go down your legs, that's called sciatica. And we're going to talk about that tonight too. Sciatica is a symptom pattern that's a part of many different types of low back pain and can be caused by many things too. But you're going to learn something tonight, Rochelle, about why standing likely is problematic for you. So just remember this: if your pain is reproducible, that's not necessarily the worst news, because that which is reproducible is oftentimes reducible. Now, I want you to understand something about trauma here. Debbie says, my pain hurts standing or sitting. Only laying down helps. So getting in a non-weight bearing position as opposed to a vertical position helps. Is it just local back pain, Debbie? Or is it pain that goes down your leg? That would be interesting to know as well. I want you to understand, though, the difference between acute and cumulative trauma. Acute trauma is what we think about when we hear the word trauma. So think about it. When you hear trauma, that usually means something bad's happened, right? You think about motor vehicle accidents or falling from a height and fracturing something. Those are all traumatic events, and that's definitely true. That is actually the definition of what we call acute trauma. And this is what acute trauma looks like. Sudden tissue damage. Let me see if I can get that to go. Sudden tissue damage. And then over time, as time goes by, it gets better. Little by little, slowly but surely. And then for most people that have acute onset lower back pain, it will eventually get below the symptom threshold, meaning they don't feel it that much anymore. With acute trauma, it's caused by a singular episode of stress. And when that episode is in the past, the body naturally goes through a healing process. Acute trauma naturally heals. What we're going to talk about tonight primarily, though, is not acute trauma. It's called cumulative trauma. Cumulative trauma looks different. It's not one incident that brings it on. It's lots of little things over a long period of time. You can see little by little something's changing. We don't know it for a while because it's below the symptom threshold. Once it gets above the symptom threshold, we start to feel it a little bit, but at that point, it's not that bad. People will say it's not terribly frequent, it's not terribly intense, the duration is rather short. But as time continues to go on with cumulative trauma, that is the result of little things repeated over and over again, day after day after day, the tendency is it progressively gets worse, and frequency of the pain, intensity of the pain, and duration of the exacerbation tends to get worse over time. Most people here tonight will say it's probably a cumulative issue in my experience. All right, Debbie, so I see you are giving me some more. Oh no, Kathy says it hurts all the time. The severe pain hits me rising up from bed. Pain can shoot down both sides of the buttocks and both legs. Pain is there at that point. If you have pain that shoots down both of your legs, Kathy, you probably have something that we're going to talk about tonight. We'll talk about that later. I won't spill the beans on that right now. Debbie says tingling down the legs. Once the pain gets really bad, it feels stuck. It feels like it locks up. Yeah, the back going out, right? Yeah. I do already have visits with Kathy and love her. Okay, or Katie. Yeah, got it. Awesome. I'm glad you're seeing Katie then. She is extremely helpful. My dog, Zeke, right there. Hey, Zeke, what you doing? He says hi. Zeke's a 135-pound Great Pyrenees who likes to bark, so don't be surprised if you hear him later on here. All right, on my acute and cumulative trauma graph there, you can see these buckets of water. So let's talk about those buckets of water. Cumulative trauma is kind of a slow, insidious process for many people, but it's very predictable. When water starts to fill the bucket, predictable things happen. The first thing that we're going to notice when our body is experiencing cumulative trauma is fatigue. I'm 50 years old. Half of my life I've been a physical therapist. It's not physically demanding most of the time to be a PT. Not like working in a manufacturing plant or digging ditches. So I'm not stressing my body out a ton. That being said, at the age of 50, at the end of the day and at the end of the week, I have more fatigue today than I did then because I'm older. My body's changing. there's some cumulative trauma that's developed even as a physical therapist. Like you, when I start to experience that, I kind of say, it's not that big of a deal. And I just kind of push through it. More water fills the bucket. And for most people, fatigue will give way to what we call discomfort. Discomfort oftentimes gets described as stiffness and soreness. It's not, that doesn't hurt bad, but it doesn't feel quite right, right? And people that experience discomfort say it takes a little bit longer to get warmed up to do things. They can't sustain their activity as long as they used to. But most people say, you know what, I'm not as young as I used to be. It's just kind of part of life, right? That's normal. We just keep doing, and more water fills our bucket. And when the water gets really full in the bucket, discomfort will yield to pain. Pain is a whole other level. It's not just stiff and sore. It hurts. Right. And usually at this point, people come to the realization that they can't just put it in the back of their mind, set it aside. When we have pain, we tend to say, I better do something about this. Most of the time, we just go online and we search something, or we pop some over-the-counter medications. Eventually, we might see the doctor. The doctor prescribed medications. That's the way we deal with these things in most cases. Meanwhile, if we haven't changed the environment and we keep taking on water, eventually it's going to spill. Now we got a problem that takes a lot longer to deal with. So tonight I'm going to teach you how we can move it in that direction, how we can build your bucket up, how we can open up the relief valve and get water out of that thing so we don't have this spillage occurring. That is the goal, managing cumulative trauma well. The reality is, though, that path, that bucket growing path, that's the path that most of you are on. And look at my slide here. You see those train tracks? If you look in the distance on my slide, you'll see a train is rounding the bend and coming your way. If we were actually on these train tracks, if we were outside, you'd start to get some evidence that a train's coming your way and you're in danger, right? You'd maybe hear a whistle in the distance and think, you know what, that's far away. That's not that big of a deal. But when it gets closer and closer, the rattling gets bigger, the noise gets louder. We're getting more warning signs that something bad's going to happen. In the human body, those warning signs aren't bells and whistles and rattling. It's pain, and it's the frequency, intensity, and duration of that pain. As we get farther and farther along the cumulative trauma pathway, frequency of pain increases, intensity increases, and duration of episodes increase as well. And unfortunately, when we hurt more, we move less. And when we move less, that is bad for our general health. In America, we spend 86% of our healthcare dollars on 6 things, okay? Number 1, musculoskeletal issues, including low back pain, easily the number 1 healthcare expenditure in America. Number 2 is heart disease, okay? I'm gonna skip 3 for a moment. Number 4 is diabetes, 5 is obesity, and 6 is depression. 5 of the top 6 healthcare spends are related, our risk goes up when we move less. Poor, infrequent movement makes us more susceptible to musculoskeletal issues, heart disease, diabetes, obesity, and depression. These are all, by the way, cumulative issues. The relative risk grows over time because we're exposing ourselves to things that create these gradual changes and progressive changes. Now, number 3 healthcare spend is cancers. Most of those are not directly related to movement-related issues, but all the others are. And so I'm telling you this tonight because I want you to feel better. I want your back to hurt less. I want you to be able to move more effectively, more efficiently, and more often, because that's good for your back. It's good for all musculoskeletal things, and it's good for your risks related to heart disease, diabetes, obesity, and depression. What I'm going to teach you tonight is good for your back and good for your overall general health. But most people don't understand that. In fact, when we start to experience some of those earlier symptoms, the less significant ones, it's really easy to ignore it. Now, I'm sitting in my house. Over there is the old part of my house. It was built in 1915. This was built in the 90s sometime. When we moved in here 7 years ago, the insurance agent came over and said, yeah, we'll insure you. Here's what it's going to cost, but here's the deal. I'm not going to cover those shingles. They need to be replaced. Well, I knew it was a big old house and it was going to cost something to do that. And so guess what I did? I ignored the problem. And I would look like, hey, you know what? There's no water spots happening now. I think I can get by for a little while. I'm thankful to tell you that I didn't ignore it too long, but what would have happened if I kept ignoring it? Eventually, there would have been bigger problems. Eventually, things that were unseen would start to be seen. And instead of having this much cost, I might have had this much cost. That's what people do when we notice there's a problem. If it's not a significant issue, we tend to ignore it. Now, if you're here tonight, you're not ignoring it anymore, right? You've gotten to the point where you're willing to do something about it. If you look online and just type in, what can I do for my back pain? You're going to find that there are tons of options. There's a bunch of people that want to sell you something. It's a multi-billion-dollar industry. The perfect salve, the perfect pill, the perfect exercise, you name it. Almost all those things do not get to the root of the problem. They are simply ways to mask the problem. In fact, even in the medical world, most of the things that we do in Western medicine do not get to the root of the problem. Medications, injections, and surgeries do not fix the root of the problem. They try to eliminate the source of pain, the damaged tissue, but we have to ask the deeper question. The question behind the question is, why is that tissue damaged in the first place? There is a deeper problem going on. For tonight, my challenge to you is, don't just mask the problem. Stop doing that. It's a waste of money and time in most cases. Find and fix the root of the problem. That's the only way to solve it. And so I'm going to tell you right now, for giving me your time tonight. I'm going to give you something later tonight. I can't wait to tell you about it, but I'm going to tease it a little bit right now. We like to say that knowledge is power, right? And just knowing this is going to be helpful, but that's totally false. Knowledge does nothing for us unless we can implement it. So I'm going to give you some knowledge tonight, but it is impossible in this format to allow you to implement it. There has to be a personalization of this information, and then it becomes much more easily implemented. So that's what I'm going to give you tonight, a way to implement this so you can actually solve the problem. Now, you have to understand this key point, though. We think of these musculoskeletal issues as a medical problem, and in most cases, they are not medical issues, and therefore it doesn't require a medical intervention if you really want to fix it. These are not medical issues. These are mechanical issues, okay? You cannot successfully solve a biomechanical problem with a biochemistry treatment. You know, pills might cover up the pain. The message that gets from your body part to your brain might be mitigated by that, but if you haven't fixed the mechanical issue, it is not going to go away. So I want you to hear this loud and clear. Movement-based issues require movement-based solutions from people who understand movement. That is the key. It's a key point. Now I'm going to give you an analogy here for a little bit. Imagine it's the beautiful day. We haven't had many of these this spring, at least if you're from Iowa, you know what I'm talking about. If it's the most beautiful day and you are driving down the road in your favorite car, okay? Maybe it's you got the top down, you get the winds going through your hair. It's just a beautiful day. You're enjoying it. Suddenly, though, a light goes on in your dash. There's my dog. A light goes off in your dashboard. If you're like me, oh, that darn light can't be trusted. Okay, so we ignore it, right? We just got to talk about that. You keep going. That's what I've done before. But suddenly, you start to hear a rattle. Okay, you start to see a little smoke coming from under the hood. You smell something. So obviously, you got to pull off, right? Would it be smart to do this? Pop the hood. Pop the trunk, you open your door and you walk to the back of the car, because in that trunk, you got this really thick old blanket, okay? And you're gonna take this thick old blanket and you're gonna throw it on top of that engine, you're gonna close that hood, and then you're gonna go to your glove box, because in your glove box, you got this duct tape. And you're gonna take a piece of that duct tape and you're gonna put it right over that dashboard light. Now I can't see the light, I can't hear the problem, I can't smell it. Problem solved, right? Does that sound familiar? That's how we deal with most musculoskeletal issues. Make the symptom go away, but don't get to the root of the problem. If we did that with our car, you're going to be in trouble. Guess what? If you do that with your body, you're going to be in trouble as well. If you don't get to the root of the problem, it's going to resurface. And in most cases, it's going to be worse as time goes by. It's not a medical problem. It's a mechanical issue. To get to the root of the problem, you have to find and fix the primary mechanical issue or issues. Now, I don't want to get deep into the weeds on this too, but I want you to hear this loud and clear as well. These are the 4 phases of healing in the human body. See phase 2 there? Inflammation phase. Now, be honest. If you're told, if you figured out, oh man, yeah, that thing's inflamed. Well, I've got a solution for that, right? When you hear that something is inflamed, what is the natural reaction? We have been conditioned to take a medication, an anti-inflammatory. We even have over-the-counter medications, Aleve and Advil, ibuprofen. Those things are anti-inflammatories when taken at higher dosages. Now, that can make you feel better for a little while, but unfortunately, inflammation is necessary to appropriately heal tissues. During the inflammation phase, the body prepares to grow this vascular framework. It's the infancy of that process that becomes mature through proliferation and the maturation that can take weeks to months to even years in some cases, with significant wound-related tissue issues. So I want you to hear this. Inflammation is not the enemy. You don't need inflammation to go away. Inflammation is part of a natural process. You need it to occur. So I would tell you that this tendency to make inflammation go away by taking an anti-inflammatory, in some cases, it's fool's gold. It stops a natural process necessary. And if you don't get this process to mature, that tissue has not got the vascular framework to feed nutrition to that tissue. And tissues that don't get nutrition have problems as time goes by. Those kind of tissues will be irritated over and over again. Now, I want you to meet my friend Andrew. Andrew is a physical therapist. But when he started developing back pain at the age of 24, he was not yet a physical therapist, and he had it bad. Andrew tells the story really well. He's a physical therapist up in Michigan, and he had back pain that was tremendous, and he got leg pain that went along with it. And he was only 24, and he dealt with it for over a year. He did the normal stuff. He went and saw the doctor and got medications. It took the edge off, but it didn't go away. He got cortisone injections. Didn't really help. They determined, you're going to have surgery, and which he did. And he did that, and he was awesome for a few weeks. But then he woke up one night in bed, and it was back again. And he was really struggling with this. Before he had the surgery, he was taking some really strong medications, some narcotics. And his wife would lay in bed with him and listen to him breathe, because his breathing would slow down so much. She was concerned he was going to just stop breathing. And that's actually one of the bad side effects of these narcotics or opiates. These painkillers do that. And some people do pass away. I had a client of mine, a 28-year-old guy who inadvertently overdosed about 15 years ago. Really, really sad situation. And so I want to get people off those medications. They do not get to the root of the problem. They can be dangerous. They mask the problem. They don't help you. You need to find and fix the root of the issue. Andrew needed to do the same thing. And he started physical therapy. And in PT school, they started measuring how the body worked at different joints. And he found out his hips didn't move the way they were supposed to. He didn't know that yet. And if you think about it, every time we take a step and stride with the next foot, we're planting one foot and moving the next, and the pelvis moves over your femur. That creates internal rotation of the hip. He couldn't internally rotate. So when he tried to do that, his body had to make compensations. His back actually took on more mechanical stress, and he didn't get better until he got his hips to move better. The root problem was not his back. The root problem was a hip dysfunction. Finding and fixing that hip dysfunction gave him a solution that lasted. And I can guarantee most of you here tonight are dealing with the same thing. There's a movement issue that's not been diagnosed and remedied. As a result, your back is experiencing mechanical stress at levels it was not designed to handle. That's a recipe for a problem. Now, the back moves like every other part, 3-dimensionally. Okay, every body part has to move in 3 dimensions. The back flexes and extends in the sagittal plane. It side bends left and right. That's called the frontal plane, and it rotates left and right. That's called the transverse plane. Now look at that. Low back is not designed to rotate. There's about 10 degrees, 5 in each direction between each lumbar spine segment. The low back is not intended to rotate. It is made to flex and extend a lot. There's 70 degrees of flexion and extension. So what happens when the hip can't rotate? Something else has to rotate, and his back was trying to compensate for poor hip mobility. That made his back do something it wasn't designed to do, and there were tissues that suffered the consequences, putting pressure on his nerves, giving him tremendous pain and shooting symptoms down his leg. Okay, so we need to understand how the back was designed to move and make sure it does its part in all of those planes and doesn't do things it's not designed to do well. When it has to do too much what it's not designed to do, there tend to be consequences to that. So we're going to talk very briefly about the most common types of low back pain, which will lead us into the root cause conversation, which is really interesting. Then we'll talk briefly about good treatment interventions when you think about that from that perspective. First of all, I want you to, let's talk a little bit about sciatica. I'm sure most of you have heard this. The sciatic nerve is the biggest nerve in the human body that travels from your low back. The nerve roots join together to make one big nerve that goes all the way down the leg. It carries motor information to the muscles so the muscles can move and flex. It carries sensory information back up to the spinal cord and eventually to the brain. And that's why irritation of the sciatic nerve can give us a variety of symptoms like numbness, burning, tingling, pain, all those sensory experiences. Anything that causes compression of either the nerve root at the spine or the sciatic nerve exterior to the spine, peripheral to the spine, can cause something that we would designate as sciatic, and that can give you symptoms anywhere down the leg. Okay. Sciatica in and of itself is not a diagnosis. It's a description of a symptom pattern that a variety of diagnoses can contribute to. Okay. And we know if it goes past the knee, it is related to sciatica. There was actually a study done, I think it was in the 60s, where they kept the person awake but numbed them, and the doctor introduced a scope and started pushing on things in the back. And the individual would experience all kinds of stuff down the legs. The only way it went past the knee is if he pushed on the nerve root. If they pushed on different parts of the back, it might cause some symptoms into your buttock, into the upper leg, but it wouldn't go past the knee unless you hit that nerve root. So a lot of people have symptoms into their buttock, into their upper leg, and they think it's sciatica, but it may not be. It might just be due to mechanical compression of another tissue in the low back itself. Okay. Let's talk, though, about the 3 most common types of low back pain. And they're all related to each other, and we'll learn about that as we go through. We're going to talk about herniated discs. We're going to talk about sacroiliac joint pain, SI joint pain. We're going to talk about stenosis. And there's a more common name for stenosis that'll probably trigger your memory a little bit more. A herniated disc. Okay, so look at the pictures here. On the left is a normal disc. On the right, a herniated one. This is a bird's eye view of a cross section. So you can see this disc has outer fibrous rings and an inner, it's called nucleus pulposus. It's a pulpy substance. Younger people have lots of motility of the stuff within the disc. As we get older, we lose motility. Most of the time, you can't see it very well in this picture, but the rings are thinner on the back of the spine, thicker on the front of the disc. We got the spinal cord running right behind the disc with nerve roots coming out. Most of the time, these disc issues are going to cause damage on the back left or the back right, which is interesting because that's right where that nerve root exits, which is why oftentimes a herniated disc will pinch a nerve and give you symptoms down the leg. Here's what you need to know about this, though. This is a younger person's disease. Herniated discs, because younger people have more disc motility, will get a disc that can move out and push into that pinched nerve much more so when they're younger than when we're older. When we lose motility, it's a different related issue. We'll talk about that in a little bit. People with this problem will say that sitting is definitely worse than standing, especially if they start to bend, if they cough, sneeze, laugh. That will cause sudden symptoms down the leg of numbness and tingling. I want you to understand that symptoms, while they can be really uncomfortable, are not dangerous, okay? Those are sensory changes. More significant pressure will eventually, in some people, cause motor changes, muscle changes. So if you notice any kind of weakness, which will be evidenced by difficulty lifting the foot or big toe with a foot drop, or difficulty controlling your bowel or bladder, those are much more emergency related issues. Those need emergency attention, but a great majority simply only have symptoms. And the good news is research shows that conservative means are just as likely, in fact, more likely to be beneficial than surgical means at making this get better. That's good news. What about the sacroiliac joint? Okay, let's dissect this a little bit. Your lumbar spine is at the low back. It's right here. And then that joins in with an area just below, which is a fused set of bones called the sacrum. That makes up the sacral portion of the sacroiliac joint. The ilium are the wings of our pelvis. So the meeting of the sacrum with the ilium on the right is the right SI joint. The medium of the sacrum with the ilium on the left is the left SI joint. Now think about this. Our entire upper body, our head, our trunk, our arms, our organs, all that puts weight that goes through the sacrum and gets transferred through the pelvis into the legs. There's a lot of weight-bearing pressure that is borne on the right and left sacroiliac joints. And that joint is not intended to move much. We don't see it on this image, but there are tons of ligaments that lock that thing down. So it is secure and stable, okay? But sometimes it can get a little bit excessively mobile there, and that's problematic. Oftentimes it's when people fall and land on their butt, and it's a acute traumatic joint laxity related issue. Most people with this issue will say in that little dimple on one side or the other, that's where it hurts. I can push and I can find it right there. It's not commonly associated with symptoms that go down the leg. It's very seldom. Changing positions hurts. It can radiate around the groin to the lateral thigh. It's usually only on one side. It can be experienced by people of all ages, a little bit more common in women than in men, especially pregnant women who are experiencing hormonal changes in preparation for the birthing process. There's much more laxity in the joints. And then, of course, we have change in the mechanics because the growing womb and the weight-bearing pressure and the position of the spine. The reality is, though, that excessive movement creates movement, which results in friction, which is inflammation causing, and that can put pressure on local nerves that send a pain signal to the brain, okay? That's sacroiliac related issue. What about stenosis? Stenosis is probably much more commonly known as arthritis. And other words you might hear describe this are degeneration of the disc or disc degeneration, bone spurring. Okay, so I can't remember, was it Kathy or Debbie that said standing up is definitely the worst? You do not need an expensive diagnostic test to confirm whether you have stenosis. This battery of bullet points is 97% accurate. If you're at least 50, if your pain is worse when you're upright, standing or walking or both, and it reduces at least temporarily when you sit down, you likely have stenosis, okay? And stenosis can affect the spot where the nerves exit. That would give you a symptom down one leg. Stenosis can also act upon the central canal where the spinal cord is. And that's most often going to give you symptoms that go down both legs. That's called central stenosis. And that usually requires core work, learning how to tilt the pelvis to unload the spine. There's lots of times tightness in the hips with people that experience this kind of a problem. Those issues, if not remedied, lead to these continued mechanical stresses that cause the pain to get more frequent, more intense, and longer in duration. Okay, does that make sense? All right, I saw someone had a comment here. Let me open that up. Let's see. This thing's a little bit finicky tonight. I'm going to make it bigger. I don't think you can see that. I've been told by two back doctors, degenerative changes, mostly L5 and 1, and need a fusion. I do get radio frequency ablation 2 years ago, yet refused to get the surgery. Nerves are growing back, starting to bother me again. I'm debating another ablation. I know Katie's going to help me. I agree. And she's really good at understanding the ins and outs of these movement-related issues. Remember what I said earlier? Do you have a symptom pattern caused by a specific activity? And then how bad and how long have you been experiencing it? It might take you a little bit longer, but the tissues that get this unnecessary pressure cry out for help, and they get more sensitive to less irritable movement stresses. But if you take stress off tissues, they start to say, hey, you know what? That feels pretty good. And instead of it cycling upward and worse, it begins to cycle slowly downward. But it's not until you find a way to eliminate the mechanical stress. We're going to talk a little bit more about that in just a moment. But thank you, Debbie, for giving me those details. This is an artist's rendition of what arthritis or stenosis looks like. It isn't really red in our bodies, but these are a side view of two vertebrae and the disc between them. You can see these bone spurs starting to develop on the edges of these bony tissues. The disc is beginning to flatten, and it actually can kind of start to spread as a result. And it spreads in the direction oftentimes of these nerve roots. As this thing starts to get closer together, the hole through which that nerve root exit starts to narrow, and there's bone spurs pushing on that. You can see why that could put pressure on the nerves and give us these symptoms that go down the leg. But I want to tell you this. Lots of people have degenerative changes. And the good news is most of those people don't have any pain. So look at this. This is imaging findings amongst people that are asymptomatic, meaning they don't have any back pain. 50-year-olds with no back pain, 80% of them have disc degeneration. 60% have a disc bulge. About 1 in 4 have an annular fissure. That means there's damage to those outer rings of the disc. These are really common. They get more common as we go up in age. And remember, these are all asymptomatic people. It's much more common to have degenerative changes and not have pain than it is to have degenerative pain changes and to experience pain. Okay, so I want that to be a source of hope for you. Unfortunately, most people find a pathology because they're hurting, and then that pathology is equated to the source of the problem, which isn't necessarily the case, which makes you more likely to have a surgery. And unfortunately, a lot of those people go through a major surgical procedure and still have issues because they still have not gotten to the root of the problem. They haven't fixed the movement-related issue. Okay. Now, remember a little bit ago, we said this thing can get better. Okay, it can go down below the symptom threshold. It showed a nice, steady line. Most times when we're getting worse, we're doing this. And as we get better, it's still going to have a little up and down to it as well. It's not like you snap your fingers and it gets better. But when you take the mechanical stress off the tissue, when you find the movement deficit and fix that, then you've got the ability to relieve symptoms at the source. And this is a good segue into the causes of lower back pain. This is really important to understand this. Remember I said earlier that every body part moves three-dimensionally. Right? The spine flexes and extends, side bends left and right, and it rotates. That's three-dimensional movement. Every body part also has to have this balance between mobility and stability. If we're too mobile and lack stability, problem, right? If we're too stable and lack mobility, that's a problem too. So we're looking for this weird word called mostability, a good combination of mobility and stability. My friend Andrew had stability in his hip, but he didn't have the mobility he needed. That was problematic. And so the neighboring areas picked up the slack and his back suffered as a result of that. We could do things to make his back feel better temporarily with medications, injections, but it kept coming back because the root problem was not dealt with, and making the hip do what it was supposed to do allowed him to stop applying movement stress that was bothersome for his back. That's what gave him the ability to manage this. So in our clinics, we talk a lot about Goldilocks, right? Goldilocks found out that there was too hard and there was too soft, and she wanted what was just right. She didn't want hot, didn't want cold, she wanted just right. So the goal when we look at you holistically is to see what is each link in the kinetic chain doing. Is there a balance between mobility and stability? Are they cooperating well together, or is a lack of ability, a dysfunction one place causing other areas to compensate? That is likely the case with many of you here tonight. And the primary culprit or culprits, some of you are dealing with more than one, by the way, are these three things. We're going to talk about your hips, your mid to upper back, and your feet. Think about today, the positions we put ourselves in. Now, not all of this is true, but compared to a generation or two ago, we sit a lot more than we used to. We sit behind desks with our computers. We sit in our cars and drive long distances. We can be sedentary and get work done today much more than we could 50 years ago, right? Okay. And there's consequences to that. When we sit and our hips are flexed, these muscles, these are called your hip flexors, they're put in a shortened position. And when those muscles are in the shortened position a lot, they adapt to that position and they get tighter in that position. Well, what happens when we stand up? Okay, the hips extend, those muscles are now tight, and it's going to have an impact on everything that it connects to. It might pull the pelvis forward, which arches the back and puts pressure on the facet joints in the back of the spine. It could pull the lumbar spine forward, which accomplishes the same thing, putting stresses on certain joints in the lumbar spine. That's fine for a while, but eventually when that stress is repeated often enough, there's a cumulative impact. It's not days and weeks, it's months and years that lead to the slow tipping of the scales. And so we need to make sure that your hips have a balance between mobility and stability. If there's too tight, there's going to be some mobility work that needs to happen. If they're too weak, there's going to be some stability work that needs to happen. We need your hips to have most stability. What about the thoracic spine, the mid to upper back? Okay, well, do this for me if you would. You don't hear PTs say this often, so take advantage of it. I want you to slouch, just really, really slouch. Poor posture. Now stay slouched and try to rotate right and left. If you stay slouched, you're not going to move much right and left. Now, sit nice and tall, good posture, do the same thing, and see how much better you can rotate, okay? If you lack mobility in the thoracic spine, if you can't rotate well because of changes in posture, other parts have to pick up the slack. People that have thoracic mobility issues, and it's almost always tightness or stability, too much stability, that's a problem at the thoracic spine. Too much mobility at the thoracic spine is exceptionally rare, but tightness and poor mobility at the thoracic spine is quite common. And people that deal with that are more often to experience neck and lower back related issues, because if that's the closest neighbors to this area of dysfunction. By the way, at the hip, the closest neighbors to the hips are your low back above and your knee below. So if you've had both low back and knee issues, it's more likely that the hip is the common denominator, the link that needs attention. Your feet, even though they're not close neighbors to the low back, can have an impact on mechanical stresses that you experience at the low back. And by this image, you can see a poor foot position can have an impact on what's going on at the foot, the knee, the hip, the low back, the thoracic spine, the shoulder, the neck. It can have major consequences. But I'll tell you this, some people just are born with flat feet. That's not great. We need to treat that, okay? Other people develop flat feet because it's a compensation from another movement-related issue, and it's usually the hip. So even foot problems are usually hip-related issues too. The hip and the thoracic spine are the two most common links that need attention with these low back pain-related issues. The bottom line is this: if you've been dealing with low back pain, if you've done what most people do, try medications, injections, surgeries, go see the doctor, get diagnostic tests, find pathologies, potentially get surgeries. That's all normal, but none of those things get to the root problem. The bottom line is you need to make sure that your hips, your thoracic spine, and your feet are doing what they're supposed to do so that there can be a balance of mobility and stability at all these individual links in the chain of movement. When one of those parts or a couple of those parts don't do what they're designed to do, other areas have to pick up the slack, and they are therefore asked to do beyond what they are designed to do which with enough cumulative repetition creates problems. Problems that start minor but become more significant over time. Make sense? It's not going to be surprising for you when you hear me say this. To eliminate the issue, to truly make it go away, you cannot just treat the back. Okay, I can do ultrasound, electrical stimulation, manual treatments, all that can make you feel better. But if you want to take the mechanical stress off the back, you got to find and fix the root cause or the root causes. Okay, and unfortunately, the most common treatments don't do that. They're maskers. They're altering symptoms. They don't get to the root of the symptom. Okay, so what successful treatment does is it gets to the root of the problem by finding your individual problem or problems. And we can't just look at the back. We need to think about the whole body, because all these parts, all these links in the kinetic chain that I've talked about, it's a part of a dynamic system, which means that when we lack the ability to do something at one area, the other parts in this dynamic system are impacted by that and try to cover for it. Okay, so you have to have a whole body approach to really find and fix that. The process is educational and empowering. And what do I mean by that? Well, there's something you need to do today, but that's going to give way to something different tomorrow and the next day. It evolves as time goes by. As your body changes, the activity you need to do to stimulate proper movement changes too. As a result, that can't happen in a group atmosphere. It is legal for me to work with multiple people at the same time, and I would charge a code called group therapy. I don't recommend it, because if it's not one-on-one, you're not getting individualized treatment and you're not getting empowered to do the right thing at the right time. And it's great to use active activities, hands-on activities, particularly if ultimately you get to the point where you're in a functional position, okay? Life doesn't occur horizontal. Life occurs upright between gravity and the ground. So all these activities need to be combined with real functional movements, where you have to teach these parts how to play in the sandbox well together, okay? So remember, we talked about acute trauma followed by time and improvement. Most of what we've been dealing with is probably this cumulative process. What we're showing here is that if we want to do successfully things to take the mechanical stress off the tissue, once we hit the symptom threshold, we change the mechanical pressure on that tissue so that it gets below that symptom threshold. There's still some ups and downs, but we're below that symptom threshold, so it doesn't surface the way it used to. Now, hopefully you have nodded your heads a few times today. I think it's great information, but we haven't solved all the world's problems yet. You can't remember all this stuff. It's impossible. Our memories are limited, and I've really hit you with the fire hose tonight. A problem still exists, because though you know what are common culprits with regard to root cause issues for low back pain, you still don't know what your problem is. And like I alluded to earlier, knowledge in and of itself doesn't help unless you can implement it. So that's why I want to offer those of you that have hung in here tonight, Natural Lower Back Pain Relief Consultation. It is short and simple. And in a short period of time, you're going to learn what type of low back pain you have. And the low back pain expert will do a few simple assessments, looking at how your thoracic spine moves, how your hips move, how your feet move, and a variety of things related to that. And they'll be able to tell you, here are the primary movement dysfunctions that are contributing to this problem. Here are your root causes. And in order to make that better, here's what a process would look like if you want to go through that. Now, that typically costs $150 to do that with us. Here's the good news. For being with me tonight, I'm not going to charge you a thing. We are offering this to you for free. If you want to come in, meet with one of our low back pain experts, spend 20 minutes, talk to them. They'll ask you a few questions, and they'll go through the proper assessments, looking at the three most common culprits of low back pain, the true root cause issue. It's not going to cost you a red cent. Now, I can give you a guarantee, but it can't be a money back guarantee, because I'm not taking your money. But I'll do this. If you do this, if you take advantage of this free screen and you say, you know what, that was a waste of my time, all you got to do is let us know. The guarantee is this, that $150 that we didn't charge you, we will give away. Okay, you just tell us your favorite charity, we're going to give it to you. We love helping local charities. We do that as much as we can. But I'm proud to say, with regard to these free screens, we have never had someone take us up on that, because it is not a waste of time. It is highly beneficial to understand what your root causes are. And there are no obligations to do anything beyond that. It's not a hard sales job. It's informational. And at the very least, you'll have a sheet of paper that you can take with you that says, here's the primary problem. Here's what the process to make it better would look like. And that's yours to take home with you. Okay. Now, if you want to take advantage of that tonight, I strongly encourage that. You can get out your phone, you can do on that QR code, but I can tell you what, the easiest thing is this. I'm going to have you hit the easy button. Just click on that chat button and say, I'm in. Okay. And then you can tell me this. We need to know where you want to go. We have 7 clinic locations. So when you say I'm in, tell me I want to be seen in Ames, Des Moines, Newton, Colfax, Pella, Oskaloosa, or Centerville. Let me say that again. Ames, Des Moines, Newton, Colfax, Oskaloosa, Pella, Centerville. Those are our 7 clinic locations. And we can get you in with one of our movement experts, one of our low back pain experts. We all see the world the same way, and we can all help you with that. Now, if you're not close to one of those clinic locations, you want to do something differently, we can do an online session too. So you can do that as well. Just click on that chat button and tell me, yeah, I want to be seen. And Debbie, Kate, you'll have some information you can share with Katie now too. She's probably already doing all these things, whether you realize it or not. All right, we got some coming in here. Rochelle wants in. She's in Des Moines. Rochelle, we will let you know. Dina's saying, I'm in. Ames location. That's awesome, Dina. Thank you. We're excited to help you too. We got some great therapists there in Ames. They do a wonderful job in the community there. Anyone else, go ahead and ring in if you want to. Michael, looks like you're in. Good. We will get you called. Debbie, yes, thank you. Katie's awesome. I'm glad you were here to learn something tonight from this video. I did promise I would give you my contact information, so at the very least, I'm a resource for you. I want to be there to help you. So jot that down. That's my cell phone number. That'll get right to this. You can call, you can text. This is my direct email. You can send that and it goes right to my inbox. You can reply to any of these emails you've been getting once you signed up to. That'll get to me eventually. If there are any key information on there, my marketing team sends that to me and I can interact with you that way too. So that's great. Let me stop the sharing here. What's going to happen after this? Tonight, later on, you're going to get another email from me. That email is going to have a link to this video so you can watch it again if you want to. And I'm going to ask you a favor. If you know people who are suffering with low back pain that would benefit from hearing the same information, would you consider sending that email to them as well? I would love for them to get this information too. It is common sense information that unfortunately most people don't hear. The research says that out of the number of people that would benefit from hearing this, and by the way, 80% of Americans deal with this at some point in their life. Of those that do deal with it, only 10% get to us. So there are lots of people unnecessarily suffering. And unfortunately, lots of people spending a ton of money, time, energy, effort, and tears not getting to the root of the problem. So it would be an honor to me if you would share this information when you get that email with your friends that deal with that too. It's going to have a link to sign up for a free screen, but if you've already signed up for one here by saying I'm in, we got a handful, maybe a little bit more that have done that. You don't need to do that again. We will contact you. You've already done what you need to do. And you can reply to that email as well if you ever want to reach out to me. Folks, it's been a huge blessing to spend a little time with you tonight. I wish you didn't deal with low back pain, but I'm happy to be able to supply you with some information that would help you. And I encourage you to take advantage of that. In the meanwhile, you've got my contact information. Don't hesitate to reach out. Enjoy the remainder of your night tonight. Enjoy spring when it finally comes. Take care.